I love this question. Is there a reason fixation suppresses nystagmus in peripheral vestibular disorders, but not central vestibular? This is actually a brilliant diagnostic clue. So let me explain why. In peripheral vestibular disorders, think BPPV, inner ear infection, Meniere's, etc., your VOR is still mostly intact or only partially or temporarily impaired. The problem is in your inner ear, but the brain's processing centers are working fine. Since your visual system is neurally spared, it's only affecting the inner ear, your brain can use visual input to stabilize gaze or suppress nystagmus. So when you give someone a visual target to focus on, the brain says, okay, I can use this visual information to dampen that abnormal eye movement. But central vestibular disorders, that's a different story. Here, the central processing centers, your brainstem and cerebellum, that integrate visual and vestibular input are impaired. The brain literally cannot use visual feedback to effectively dampen those abnormal eye movements. It's like having a broken integration system. The visual information is getting in, but the brain cannot process it properly to suppress the nystagmus. This is why central nystagmus often persists or increases with visual fixation, and it tends to be more complex. You may see a vertical nystagmus, a direction-changing nystagmus, gaze-evoked nystagmus, things that just don't happen with peripheral vestibular disorders. So if you see nystagmus that doesn't suppress with fixation, you're looking at central pathology until proven otherwise. And that's a red flag that needs immediate medical attention. This kind of clinical reasoning can literally save lives. And that's exactly why you need Frenzel lenses at a minimum in your practice. It's not just enough to have your patients look at an object, because room light can suppress nystagmus. Without Frenzel lenses, we're potentially missing critical diagnostic information. So do what you can just at a minimum to get a pair of Frenzel lenses. Of course, video oculography or video nystagmography can even bring more diagnostic value, but that's not always affordable. Thanks for that question.